My dear friends, welcome back to the Heart Guardian podcast for a healthy heart, a series powered by the Maharashtra Institute of Health Sciences and the Madhabag Institute of Preventive Cardiology. I'm your host, Dr. Aman Kapoor. Today we are going to talk about something that has become incredibly important in our daily lives: medical appliances at home. There was a time when all we had was a thermometer. But now, with the challenges of seeing doctors and visiting hospitals, having a few key medical devices at home can make a big difference in our health management. To help us understand more about these appliances and how to use them, we have with us the eminent cardiologist Dr. Jagdish sir. Sir, welcome back to this episode. Please guide us. Why is it so important to have medical appliances like pulse oximeters, thermometers, blood pressure monitors, and others at home, and how they can help us keep a track of our health? Over to you, sir. Please guide us.
There was a time when there used to be only a thermometer at home. But now we need to have multiple medical appliances. Getting to a doctor has become so difficult. Getting to a hospital is even more difficult. So we need to have some medical records at home, some medical investigations at home, so that help us monitor ourselves and also help the doctors treat us when we visit them next. The family doctor institution, the home visits have become obsolete. And that's why for initial diagnosis, or maybe follow-up data, it's important to have these medical appliances. They could be one as a pulse oximeter, which became so popular in COVID period. Every household had a pulse oximeter at home. It could be the thermometer gun, which is now graduated from a mercury thermometer to an electronic gun. Of course, the weighing scale, a glucometer wherever it is relevant. And of course, every household must have a blood pressure apparatus, the BP apparatus. Smartwatches are so common now. So a good smartwatch can give you excellent data related to ECG abnormalities. And a pedometer, which is inbuilt in it, gives you the number of steps per day, the calories spent, and it's an excellent motivator for somebody who is not very keen on exercise. So let's look at them one by one, how to utilize them, how scientifically they can be useful to us. The pulse oximeter, as I said, popular is not a right word for it, but it gotten into every household during the COVID period. Pulse oximeter is a simple device which is used on a digit. The nail bed needs to be covered by the pulse oximeter. You have to sit in one place quietly. Your finger should be dry. It should be inserted in the pulse oximeter after the pulse oximeter is switched on. And there should be no extra movement of the finger or the hand. Once you hold this for 30 seconds or so, graphs appear, which up and down movement is seen as a form of pulse wave. And there are two digits which appear. One is SpO2, which is the oxygen saturation of the blood. A normal person would have anything above 96% of the SpO2. The other one is a pulse, which is the heart rate, and it should be, normal person would be between 70 and 85 per minute. If the heart rate is slow or the pulse is slow, it can be noted, or a fast rate can be noted. There are many patients who have a rhythm problem. That means their pulse accelerates suddenly. That can be wonderfully picked up by the pulse oximeter. Many a time these patients reach the doctor after some time, and by that time the abnormality has disappeared. Pulse oximeter doesn't give the ECG or doesn't give the diagnosis of the arrhythmia, but gives you at what rate was the heart beating. Sometimes it is technically called bradycardia, that means slow pulse rate, or it could be a tachycardia, fast pulse rate. Excellently used by doctors to make a diagnosis and treat the patient. Many times the patients are on drugs which make the heart slow, and for a continuous monitoring of such patients at home, it's an excellent device. Cost is not much, and the information that it gives is phenomenal. So I would think it is one of the most cost-effective devices that has entered our homes because of COVID. The SpO2 actually represents the oxygen saturation in our blood, and people who have asthma or lung problems, or in fact some people who have heart failures where their lungs get flooded with fluid, drop their oxygen saturations, and they can be excellent monitors for these patients. This can be reported to the doctor quickly, and some immediate actions can be taken. The thermometer has excellent value, as anybody would know. We know the values of measuring the temperature from children to adult or for octogenarian people. The thermometer gun used to be used on the forehead to start with, but now all of us know that can be used on the wrist. Avoid hot items or like tea or cup of tea or cold like the ice when you are using this thermometer. Weighing scale is a wonderful addition nowadays, especially for heart patients. Many heart patients build up fluid in their body, and by the time they reach the doctor out of breathlessness, their fluid overload could be 5 to 6 liters, that is about 5 to 6 kilograms put on. This can be easily diagnosed early at home when the fluid overload is hardly 1 or 2 liters and 1 to 2 kilograms are put on. We instruct these patients to keep a daily weight chart. The first task in the morning is to get onto the weighing scale and record the kilograms properly. If one puts on 2 kilograms in 2 days, obviously it's not going to be overeating which has done the trick. It's the fluid overload, and it can be reported to the doctor quickly. So immediate measures can be taken, and hospitalizations can be prevented by the simple preventive steps at home. Of course, weighing scales are good for everyone in the family which is watchful about weight. For someone who is on a weight-reducing diet, somebody on a course which is managing their weight very well. It is also great for people who are frail, that means elderly people who have lost weight and now they are well below 50 kilograms. Even for them, the weighing scale is good. This entity called a frailty can be diagnosed by the weighing scale only and can be corrected by the correct diet, some changes in the medication, motivation, and treatment of depression. Glucometer is a wonderful addition again for the home medical appliances. Those who are diabetics must monitor their sugars very regularly. This schedule could be given by their doctors, but on their own they can measure the morning fasting or blood PP sugar readings. You have to wipe the finger clean. Don't pinch it very hard, but once the jab is made, a drop of blood will appear, and within no time it will give you the blood sugar level at that time. This helps in other ways also. People who get hypoglycemia because of medication, because of non-eating, can drop their sugars at dangerous levels, can start sweating, they become uneasy, and the whole thing starts looking like a heart attack. But a quick measurement of blood sugar will give us the diagnosis, and very simple measures can correct or prevent complications related to this low sugar or hypoglycemia. The number that appears when you are doing a finger prick sugar is different than the intravenous blood sugar measurement, but the difference is quite acceptable by the medical fraternity. And once you report these to the doctors, appropriate precautions will be taken to interpret them. Smartwatches now actually are appearing on every wrist, and everyone boasts of their own smartwatch. These are medical appliances actually, can calculate the pulse rate very effectively, keep a track of the weekly monthly, yearly average of the pulse rate and motivate people to regulate that. Smartwatches nowadays can diagnose atrial fibrillation, a very peculiar kind of a heart rhythm which comes and goes and difficult to catch, because most of the time when you go to a doctor the ECG would be normal, but atrial fibrillation could have happened at night for a short time and gone away. And more importantly, such intermittent atrial fibrillation can lead to strokes and paralysis. So it's important to have a smartwatch that can detect atrial fibrillation in certain kind of individuals when the doctors want to investigate their rhythms for a stroke that happened to them. Reliability of the smartwatches was in question to start with, but slowly they have come of age. AI interpretations have gotten added to it, and smartwatch today is really a smart device to wear, especially from the medical point of view. Amongst all the medical home appliances, I feel in today's world for adults, the most important device is the blood pressure monitoring or the BP apparatus. Each one of us must measure the blood pressure, say once in a week, once in a month, based on the severity or the requirement of that individual. These electronic devices were thought to be inaccurate. Actually, they are very accurate, but they are very sensitive to the method by which the pressure is measured. Such a device should be kept on a table. One sits in front of the table on a chair with two legs resting on the floor. The legs should not be crossed, they have to be separated and placed on the floor. Your back should be rested on the chair. Your arms should be almost perpendicular to your body on the table. So your arm, your tabletop, your BP apparatus and your heart, they all have to be almost at one level. Suppose the table is well below or above, the measurements are going to go astray. Once you assume such a position where you are in front of the table, two legs on the floor, back rested, arm on the table, and the cuff then should go onto the arm that you are trying to measure the blood pressure of. Either of the arms is good enough. Once the cuff is on the arm, just keep sitting for exact 60 seconds. There are people who advise taking 3 BP measurements in a span of 5 minutes, but most of the times our practical experience is people run out of steam within 5 minutes and can't do that ritual at all. One of the practical via media that I thought of was to sit in that position for exact 60 seconds, and once the 60 seconds are over, switch the blood pressure monitor on. It will measure the blood pressure and give you 3 readings. One is the systolic or the upper blood pressure, the diastolic or the lower blood pressure, and the pulse rate. All 3 have to be documented, or make a photograph of the monitor which is showing all these 3 figures. This would precisely measure the blood pressure and would be a wonderful piece of information for yourself and for the treating doctor. When to measure the blood pressure is also important. It should be measured when you have not exercised recently, you've not had a cup of tea, you've not had an argument, no smoking, or a full meal for that matter. So such a situation, you have to find out which part of the day would be fulfilling all these requirements. According to me, on a Sunday, maybe 3 to 5 in the afternoon is the best. When you have rested for some time, your afternoon cup of tea is yet to come, and your other activities are yet to start. So this should give you the best resting blood pressure, which is what we want to record most of the times. The other times when you want to record blood pressure is when, suppose you get an abnormal headache or you feel dizzy and you want to find out what the blood pressure is. That time it can be measured for that particular symptom. But as a monitoring of somebody who is on treatment to see whether the blood pressure reading is appropriate or not, it should be done when the person is resting. A normal person's blood pressure is below 135 systolic and below 85 diastole. Any alarming deviation should be reported to the doctor. But a record which is maintained over a period of time gives the trend, and that trend is probably more important to treat a hypertensive individual than just a one-off reading. So I feel that BP apparatus should be at every household. Every adult should know how to measure a blood pressure accurately. And this vital piece of information can prevent a lot of complications related to blood pressure, prevent major catastrophes like a stroke or a heart attack. So from very simple mercury thermometers, we've come a long way. When we have first aid boxes, we have some antacids at home, painkillers at home, the medical pharmacy as we develop at home. But medical home appliances now have made a big way. They have to be there in every household, and they have to be utilized in such a way that the doctors treating you applaud you for the way you are looking after yourselves.
Thank you so much, sir. That has been indeed an eye-opening session for all of us. Friends, if you have medical appliances, start using them well. If you do not have, as guided by Dr. Hiremat, have some basic appliances ready with you to help you keep a good record of your health parameters and to keep your health in track. And you know what to do. As always, follow this podcast, subscribe to this, share this podcast series with all your friends, family members, because this knowledge is something that can help save lives and prevent diseases, especially the heart diseases. So share it with all of the friends, and remember to like and comment on the podcast series, especially if you are on Spotify. If you're listening to this on Spotify, do drop in your comments and let us know what more would you like to listen and what do you feel about this episode. Till the next time, I'm your host and friend Dr. Aman Kapoor, signing over and out. Bye-bye.